Hello, I'm Dr. Pizzadili. This video is part of my Happy Outcomes for Cancer Patients series, number 45, Recto-Sigmoid Cancer. This case report is from the book, One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelley, written by Dr. Nick Gonzalez, completed in 1987, published in 2010 by New Spring Press, and the research was supervised and cases verified by Dr. Robert A. Good, MD, PhD, who had been the director of Memorial Sloan Kettering Cancer Center, one of the preeminent cancer research and treatment centers in the world. Patient 45 had metastatic recto-sigmoid cancer. This was a 47-year-old male, and he was found alive nearly 10 years since diagnosis of the metastatic recto-sigmoid cancer. In early 1977, he experienced episodic abdominal pain associated with constipation and a 10-pound weight loss. His condition worsened over 6 months, and on multiple visits to his MD, they discussed the symptoms as insignificant and recommended no testing. In September of '77, he passed a large amount of blood in the stool, so was referred to a proctologist. A sigmoidoscopic exam revealed a large rectal tumor. He was admitted to Lancaster General Hospital, and he had surgery to remove the tumor along with the upper rectum. The pathology report from that surgery: an ulcerated, poorly differentiated adenocarcinoma growing through the bowel wall with all 7 lymph nodes examined positive for cancer. This is a very grim pathology report. The doctors advised that the disease would most likely recur and prove terminal despite any and all therapy. They recommended chemotherapy anyway while he was still in the hospital. In October of '77, he went home and continued treatment as an outpatient. Since the prognosis was dismal, he began investigating alternatives. In September of '77, he consulted with Dr. Kelley and began a program of nutrition, detoxification, and enzymes. He refused additional chemotherapy. With Dr. Kelley's program, patient number 45 gained weight and enjoyed an improvement in his general health. Also, the chronic psoriasis that had resisted all previous treatment also resolved. And he followed the program for 3.5 years, after which he tapered down to a maintenance program, which he still follows. 10 years after diagnosis, patient number 45 was in excellent health with no signs of cancer. Now, there are several aspects of colorectal cancer that predict a poor outcome. A poorly differentiated adenocarcinoma is the most aggressive colorectal cancer. Ulcerating tumors that encircle the bowel have a particularly dismal prognosis. The 7 positive lymph nodes in this patient predict a no better than 10% chance for 5-year survival. And patient number 45 had a 3-month course of 5-fluorouracil chemo, which has never been shown to extend life in patients with colon cancer. And we see these quotes from the official literature. The prognosis for rectal cancer, once metastatic to multiple regional lymph nodes, as with this patient, is dismal. And a quote, lymph node involvement is the most important prognostic variable for colorectal cancer, with a chance of survival decreasing as the number of affected lymph nodes increases. And a quote from another textbook. Copeland and his colleagues describe a 10% 5-year survival rate for colorectal cancer patients with at least 5 cancerous lymph nodes. And now these are patients who had surgery with aggressive chemo or radiation or both. Patient number 45 faced very poor odds. He had the worst type of colon cancer, the adenocarcinoma. He had the worst type of tumor, the ulcerating and encircling the bowel. And he had cancer in all 7 lymph nodes tested. So therefore, his long-term survival and freedom from cancer, thanks to Dr. Kelley's program, is extraordinary. So ladies and gentlemen, here we see yet another case where under conventional cancer treatment, the patient faced pain, misery, and early death. Then they chose a non-toxic alternative and got a much different outcome. Health was restored, and they lived and enjoyed life far beyond all predictions. We must remember, conventional cancer treatment industry is focused on shrinking tumors and not on restoring health. Conventional cancer treatment is extremely toxic and risky. We know that chemotherapy and radiation themselves cause cancer. And we know that surgery and biopsies themselves spread cancer. Instead of applying chemo and radiation and hoping that the cancer dies before the patient, we work together with you to restore health, strength, and vitality so that your body rids itself of the cancer. So here's an important question. Are you doing everything possible to recover your health? To survive cancer, you must establish these foundations. An optimal body pH, that's your acid-alkaline balance. It's well established that all the enzymes, all the chemical processes in your body depend on the right acid-alkaline balance. And most of the people I see, especially the cancer patients, are way out. We must balance hormones. We're in an epidemic of hormonal cancers. Breast cancer, uterine cancer, ovarian, testicular, prostate cancer. There are too many people suffering the hormonal cancers, and we want to restore hormone balance. We must detoxify your body, mind, and emotions. Many cancer patients are walking around with a mindset of, oh my God, I'll never get over this. It's hopeless. It's the worst news. I mean, really, to get a diagnosis of cancer is about the worst thing anyone can ever tell you. We work to help change that mindset and that emotional set to realize the possibilities of getting better. It may be the biggest obstacle to healing. We must eliminate infections. Very often cancer strikes when the body's immune system is exhausted from fighting long-time chronic infections. One of the leading causes of liver cancer is chronic hepatitis C. We must rejuvenate depleted organs, glands, and systems. The #1 risk factor for cancer is aging. And folks, that means anybody over 40. Because after that age, we actually become depleted of the essential nutrients, the essential enzymes that run our body processes and keep us healthy. And then we must use the best proven cancer-fighting nutrition. There are nutritional items that have been shown to kill cancer cells, but they're sadly lacking in most people's diets. They're already out there in the food. They already exist in nature, but we're not getting them. And so people end up with a cancer diagnosis. What's very sad is that chemo and radiation make all those important health factors worse. Now, I'm not going to be your MD or your oncologist. And those treatment decisions are going to be between you and the prescribing doctor. I do not diagnose or treat cancer. I don't do what the MDs and oncologists do, and they don't do what I do. I will work together with you to restore health so that your body heals itself. These patients in my Happy Outcome series had the courage to take their fate into their own hands. Many did so in spite of opposition from their medical doctors and in some cases from their families. But they enjoyed recovery and health completely outside anything seen in conventional cancer care. So ask yourself again, are you doing everything possible to recover your health? Think of your family, the people who love you and want you around. Are you doing everything possible to protect yourself and them? So if you have cancer, get help. Call my office, 907-272-6299. I look forward to seeing you, and I look forward to making your health and your life great again.